In three, two. All right, it's time to talk with our featured guest, Dr. Joanne Block Rief. Joanne, how's it going?
It's great. It's, later in the evening, but I'm ready to do this. I'm excited.
Nice. Yeah. Last time we spoke or we did an episode, it was episode 153, Crossroad Dental Arts. And we talked about marketing a little bit, but since then, what's happened? How have you grown? What's coming along?
Well, I don't remember what year that was, so I'm not 100%. It's got to be. It was definitely before COVID,
Yeah.
correct?
Yeah.
Yes, 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 definitely. Well, yes, a lot's happened because I've taken on two associates now. I probably had maybe a part-time or full-time. Now I have two full-time associates, which has allowed me to be able to cut back clinically, enjoy life a little bit more, but do a lot of more managing the practice and now doing a little bit more speaking, which I hadn't done in a bit. And spending time with my grandchild because I have a granddaughter now. I forgot to mention that. In fact, she's 18 months old today.
Oh,
And
nice.
I get to babysit once a week and see her whenever I want. And, they don't live too far. So that's really great. They always say, raising your children is one thing, but the grandchildren is a whole different thing. So,
Yeah.
so yeah. So, did you want me to, since it's been so long, did you want me to give a little bit of background?
Yeah, give a little bit of background. And then after that, I kind of want to dive into the associates that you hired on full time. But tell us a little bit about your past, your present. How'd you get to right
Sure,
now?
sure. Yeah, well, I probably have a very different story than a lot of people because I'm a third generation dentist. So my great uncle was a dentist and my father worked with him for a short period till he moved about an hour away and opened an office in Annapolis, Maryland. And then my father was a dentist, retired now. And I worked with my father for 18 years as an associate before I opened my own or bought a practice, I should say, closer to where I live because I was commuting a distance. So, but when I started working with my father, I actually started when I was 13 years old, obviously not as a dentist, but I did a lot of things in the office for him. And back then there was no digital x-rays. There weren't even, there wasn't even an automatic processor. We were doing the hand dipping of the x-rays. So the assistants would take the full mouth series for the whole week. And I would come in there, whatever it was, Wednesday afternoons, hand dip the x-rays, mount them. So at a very young age, I knew how to mount x-rays. So I knew how to look at teeth. And then I would go into the office, my father's private office, and they'd have index cards from January through December. And I'd take out the month that was approaching. And I would call all the patients because those index cards were actually their recall cards. And I would call the patients and get them scheduled that hadn't scheduled their appointments. We didn't do a lot of pre-booking then. That wasn't quite a thing. So that's how I kind of started out in dentistry. And then when it was time to go to college, I said, well, my father said, you can do anything you want. I'll pay for college. However, you're not going to be a school teacher because they're a dime a dozen. I said, okay, I'll be a dental hygienist. Didn't even really know what a hygienist did because I was busy hand tipping the x-rays, but I went to hygiene school and I got a bachelor's. I went to University of Rhode Island. I got a 4-year degree. That's what I wanted to do. And then when I was in my junior year, like starting in the clinic, I said to my dad, I think I want to go to dental school. He says, I told you. I said, well, I just decided or whatever.
Yeah.
So anyway, I had to go to some evening classes and I took 2 summers and went right to dental school. So there was no gap year or anything like that. And I went to University of Maryland, where I'm from, graduated, in 86. And so now I'm 62 years old and I did the math and I've been in dentistry for 49 years because I started when I was 13. So that's probably different than anybody who is probably even listening to this podcast. And so I bought my own practice, small practice, 18 years ago, worked for Dad for 18 years. And it was a small practice and I shared space with someone, which did not work out, of course, never does. And built that practice by marketing, learned to market. I didn't even know what the word marketing meant back then. And then grew the practice. And then 5 years into the 6-year lease with the woman that I was sharing space with, built an office across the street, then kept growing that, then expanded it, and then started taking on associates. So that's been challenging. The associate thing has been very challenging because either our philosophies didn't jive or they wanted their own practice or whatever it was. But now I have 2 associates. One's 4 days a week, one's 5 days a week. Still young, they're young, but I'm feeding them like everything.
Mm.
Like every new patient that we can, unless they're specifically want to see me. And we're really trying to gear the patients to see them. Not necessarily as an exit strategy yet, but I want them to be busy, and then whatever's left over, I'm doing. So if they have full schedules and someone breaks a tooth, then I'll see them. Or if someone specifically, if I go into hygiene and do a check and they want me to do the crown or whatever it is. So yeah, and I'm spending a lot of time on marketing still. I mean, I use a marketing company, but I do a lot of hands-on, and I'm trying to do less hands-on, but still be able to have, some control over the practice, and really trying to manage to make sure that these associates are busy. And that's how we are right now.
That's kind of tough, Joanne. How do you do that? How, if you don't mind me asking, how many associates have you like gone through?
Oh yeah, I don't want to think about it, honestly. My dental CPA says it usually takes 3 to find the right one. Well, I have to say it's probably been about 7.
7. How is it like? How was it like when you were saying, okay, I really am trying to train these associates? Is it me or is it just them kind of thing?
I think it's a combination. I think that a lot of times the associates did not have an owner mentality. And unfortunately, a lot of them, weren't doing the best dentistry, or the patients didn't care for them. And it wasn't that I wouldn't have taken one on as a partner. We really never, even got that far. But I don't know. It hasn't been easy. It has not been easy. But, I keep trying, and I have 2 associates that I really like now. We just did a team appreciation dinner tonight, and of course they were there. And, I would love it for them to get really friendly and really become real colleagues. And, maybe I would love for them to both buy the practice one day. So we'll see.
Yeah.
We'll see.
Do you
Working
feel
towards something.
That's good? That's good. Do you feel like when you're there, production and collection is a lot higher, and then when you're not there, it's like you're trying to push those associates to offer more of these procedures that will increase production and collection, but you're not really seeing the needle move? Has that ever happened with an associate?
I'm trying to set them up for success. So I try to make sure that their schedules are busy enough. Yes, when I'm the biggest producer, yes. But I keep looking at my numbers, and I keep working less and less this year, and the numbers are the same as last year, and my numbers are the same. So I'm not quite sure how it's all working, but somehow it is, because I'm still seeing patients. I'm doing, let's say the bigger procedures. I'm doing the cosmetics, the Invisalign. I mean, they're starting to both do some Invisalign, so that's great. They take out a lot of teeth. I don't anymore. I like taking out teeth. I did a surgical extraction today, but they really like doing that, so I'm letting them do that. They like doing endo, so I'm not doing any endo. We have a real strong hygiene department, because since I was a hygienist, so the hygienists do a lot of non-surgical perio, very strong hygiene program. And we still do a lot of removable. I did an all-on-4 case a couple weeks ago. They're not quite doing that yet. So it's still a lot of bread and butter dentistry. We don't place any implants. Like we don't do any sedation, no sleep dentistry yet, sleep appliances, that kind of thing yet. We'll see, we'll see. I would love my associates to place implants and do some of the procedures that I don't do. But they're still youngish. So we'll see. We'll see. Really, where we are, we have plenty of general dentistry to do, bread and butter dentistry. We are at a network with a lot of insurances, more than we were when last time I spoke to you. So we've been definitely going at a network. I wouldn't say we're fee for service, but we are at a network with quite a bit now. And we have our own membership plan. So that's nice too. And that's been building up since we started it.
That's nice.
We kind of started that kind of early on. Like we do our own. We don't have a company doing it. And I kind of like it that way. I only want to pay a company when we can keep it in-house.
The membership plan.
Yeah, the membership plan. Yeah. I designed it with my old office manager, who did not come back after COVID. And we did hire an attorney, a local attorney. It took me a while to find somebody who dotted the I's and crossed the T's. So yeah,
For
I
the
mean,
membership plan. Nice.
husband and
Okay.
wife joined today. Yeah, we have, the different levels of, ages or spouses and all that.
Yeah.
So works nice.
Okay. I like what you said. Like you're asking your associates, or you're noticing what they like, and you're kind of letting them do more of that, right? So they're kind of enjoying it, being a part of it, instead of like, it's all about you and, hey, I don't like doing that. I don't care if you or you don't like doing it. I just don't like doing it. So you're gonna have to do the stuff I don't want to do, kind of
Right.
thing. You're thinking of your associates first. It's interesting.
Well, yeah. And also, like I said, I'm giving them like all the new patients. I mean,
Mhm.
I know most, or I shouldn't say most, a lot of dentists will cherry pick, what they're
Mhm.
going to. Now, if someone's coming in for a cosmetic, whatever, usually they're on my schedule because I've, taken more of the kind
Mhm.
of classes and
Experience.
stuff. Yeah.
Yeah.
And I've had more experience. But, you know, eventually, sometimes they'll be over my shoulder or whatever. We've done some of that too. And I've helped them do some smaller cosmetic cases, which is great. And yeah, so far, I really like these two women, and one went to Maryland, one went to Columbia, and yeah, we'll see.
It's working out. Yeah. Awesome. How did the strategy go with becoming out of network? How is it coming along? Like, did you guys just decide we're going to start dropping here and there? Is it once a month? And then how did you tell the patients? How did you
Well,
introduce
we
the membership
started
plan?
a long time ago. This was wow, a long time ago. I hired a consultant, um, and I'll think of his name, hopefully. And that's sort of his forte. Is he helps, like, some consultants
Mhm.
do this and some consultants do that, and that's sort of his forte, is helping you not only analyze your plans, but get a strategy and get the team on board. Because what I found with my team years ago, this was a different team, obviously, for the most part. Um, they thought that all the patients were poor and they couldn't afford the dentistry that we had to offer. So we really had to get him to come in and kind of not only, like I said, he did a lot of homework before he came in and we analyzed each plan, but
Mhm.
he really kind of, really sat down with the team and we had meetings to try to explain to them why we were doing this. So years ago, we started with Aetna, which we didn't have a lot of patients with. And luckily the in and out of network benefits, at least for the hygiene procedures, were pretty much the same. So we didn't lose patients. But then we went to the MetLifes, and now the Deltas we did. And so, but some of this was like years apart. And now we
Mhm.
just did Guardian. We did a bunch of small ones. But we still have a couple biggies. In our area, the big ones are the Blues, Blue Cross Blue Shield, and United Concordia. Those are the two big ones that we have. But we don't say like this doctor's in network and this is not. So we're either in or we're out. So
Mhm.
um, we've lost some patients, especially with the Deltas. And now with Cigna, we went out with Cigna recently. And some of the Cigna plans are fine. There's not a network benefits are this similar or the same, but some of them are awful. And
Mhm.
we have verbiage that I call it the Delta question, but now it's also the Cigna question. How do you answer the Delta question? How do you answer the Cigna question? So, our front desk team is trained, and
Do you know the
you're
verbiage? Do you know?
well, first of all, if the patient says, "Do you take my insurance?"
Yeah.
We back away. We're supposed to back away. Let's get away from that insurance credit. Oh, well, let's find out more about you and why you're calling our office. Let me tell you how fantastic our doctors are,
Mm.
and that kind of thing. Get away from the insurance question. But we don't mislead. There's dentists I know that mislead the patients, and we will say to them, we were given some verbiage by a consultant, and it was misleading. So we're not doing that now. And we say to them, we have lots of patients with Delta. Lots of patients come here. However, we are considered an unrestricted provider, which means we're out of network. So why don't you come in? Let's see what your needs are. Let's formulate a treatment plan and go from there. And that seems to work pretty well.
Gotcha. Okay. That right there, everybody's trained in the front office to say that, do that. You know what I mean? Do you train anybody to offer the membership plan, or is that like once they're in the operatory?
Well, typically, if they have insurance, they want to use it for something. But no,
Mhm.
if someone calls and they don't have insurance, we tell them right up front. We don't, and to me, that's like misleading because we don't want patients to come in and be paying our regular fees and then know that the next patient comes in has the membership plan and they got discount on whatever.
Mhm.
So we tell them, because I think it helps. So they think they're already getting a bargain when they come in if they know that they can join this membership plan. I always say it's like joining Sam's Club. Oh, I like Sam's Club. Oh, that sounds good. Some of them say, I already belong to Sam's Club, so I'm already in, right? I'm like, no, no, no. Not in. So
Yeah.
yes, we hook up the plan when they come in so that when we print off a treatment plan and go over it with them, we do 20% off, except for cosmetics and Invisalign. It's basically, I know a lot of them do 10 and 15, but we do 20% off. And so when they come in and we formulate a treatment plan, the cost of the plan will be on the treatment plan and then the 20% off. So they already know they're getting a bar, they see the differences.
Gotcha. Okay. I noticed you said previous team that was with the consultant to help you like, guide you out of network. Did the team members keep fighting it or
They definitely got better with all that.
okay.
Definitely got better. Yeah.
But it was just more, I guess it's more like, have you noticed where it's sometimes team members are still fighting a specific thing that they've been doing in the past? You're trying to push them to do something different, a different mindset or something. Has that ever happened?
Yes. I mean, your example was right. I mean, when we talked about trying to go out of network, I did have some pushback back then. I think now I'm a better leader. I think I still have, believe me, we've had real challenges with the staffing. I mean, it's just been a couple positions just constantly rotating because I have a bigger staff now too. We have a total of 15.
Oh, wow.
Yeah. Yeah. So it's been and my husband keeps saying it's the area we live in there, so it's been hard. I mean, look, I had an office manager. I thought we were thick as thieves. She was with me for about 12, 13 years. And she just became a different person after COVID. And it was a long story, but she did not come back after COVID. And
was it more because
no
like she felt
no notice, and she held the keys to the kingdom. So it was really challenging.
Did she feel like, did she tell you why she didn't come back, or could you feel it?
It's a really long story, but she had some medical problems. Now, I'm not sure if they were real or, and she kept getting doctor's notes she's not coming back for this. She's not coming back till then. And it kept going on and on and on. And I got a letter from a doctor, and I questioned it, and she just sent me a text. She's done.
Yeah. She like lost it after that.
Yeah.
That's interesting.
So yeah. But as it turns out, whenever a team member, I mean, I have heard this and I found this, when a team member leaves, you always find out that maybe some of the things they were doing weren't the best, or maybe the write-offs weren't correct, or, they weren't doing the Invisalign charges right. There's, a lot of things we found out, after she left were not being done thoroughly or properly. But I mean, she was a hard worker. I'm not quite sure where some of these things slipped, but so what I did was, because she was doing all the insurance payments and all that, she was putting all that in, and no one really knew how to do that in my office. So I was like, oh my goodness. So I hired an outside person, to do that I knew of, and she helped for a while. And then my Shine rep says, well, have you ever got in touch with so-and-so? And I said, well, who's that? They said, well, she's a Dentrix trainer, because we use Dentrix, and she lives practically in the backyard of your office. I'm like, who? What? So that was, when was COVID? 2+ years ago.
Yeah.
And she came to our office. She taught other team members, because we sort of moved some people around within the office, and she taught them everything they needed to know about Dentrix and, posting payments and all that, those kinds of things. And to this day, in fact, she was just at our meeting. I mean, the dinner we just had tonight, we had a leaders and a team appreciation dinner. She still comes like every other week to do tasks and things that we either don't have time for, we're not sure how to do, we have questions about. And she's a Dentrix trainer, and she can do, I mean, she negotiates higher fees with the insurance companies for me, because that's like a time consuming task and different things like that.
Wow. What's her name?
Gajiba Campbell.
Gajiba Campbell. Wow, that's interesting. I like that. Real quick, 15%, and rewind it even a little bit more. That's super tough, Joanne, to like know that, hey, things were going a little bit better, but like you said, you were thick as thieves, right? Like you and your office manager, you would have never thought to let that person go in order to make it better. It's until like they, you know what I mean? Kind of where like they just got up and left kind of thing. That's tough.
Oh yeah. I mean, things were doing very well when she was there, but my 2020 collections were just a little bit higher than 2019, despite COVID. In fact, I wrote an article about it for Dental Economics, and we were closed for what, 6-8 weeks. Yeah. And then she was gone. And then 21 was like 35% higher, our collections.
Wow.
So yeah, it was incredible.
That is incredible. If you don't mind me asking, how much is your overhead percentage?
In the low 50s.
How do you do, how well, for 15?
Say 55, we'll say 50, you know, and yeah. Well, I order all the supplies, so I know what we're doing that. I don't think our salaries are outrageous, even though we have increased with all this. I keep the schedule full. So if your production is high, then everything else, falls into place. But I make sure, I always say, if there's an empty dental chair, we're all temporarily unemployed. I always felt like if I kept the dental chairs filled, and that's why, like I said, I'm managing now, I'm making sure that these chairs are full. We have a lot of marketing things going on. A lot of ways, we have 3 different ways from our website to be able to make an appointment. We have a chat. We have a lot of people in the chat. We have a local med. Get a lot of people booking through local med. And I fought local med. I said, this will never work, but they give you like, I don't know, a couple months free or whatever. Yeah. It's been the best thing. And you know what local med is, I'm sure. Yes.
Yeah.
And then we also have a request form. Like if some people just want to request information and they put down what they're interested in and maybe a potential date. So on my website, and it's pretty much on every page, we have all, 3 different ways to get in touch with us. So our new patient numbers are nice and high. They're where they should be for the amount of providers that we have. And, we're trying to make the most of every new patient. And, I think our treatment planning and case acceptance could be a little bit better. But we're working on that. We've always had, not always, we've had an iTero for many years. And then we got a second iTero. And then we just got the newer one. And we just got a second newer one. So we've started, our Invisalign rep sent in a woman, she's actually a hygienist. And she has trained my hygienist and my assistants to get faster and better using the iTero and to do the wellness screenings. So that is really starting to take off. I just heard Josh Austin, you know Josh, don't you? Just heard Josh Austin speak, and he showed a graph of what his production was before doing the health screenings with the iTero and after, and it was amazing, the difference. Amazing. So we're working on that now.
Yeah, that's going to be, so how many new patients are you getting a month right now around?
Average of 50.
Wow. Okay. And so
a month 60 something, but we need that many with 2 providers who don't have a real big, patient list yet.
Oh yeah.
So we need that. We need that.
Yeah, definitely. Talk to me about what are you doing right now as far as, I know you mentioned a little bit of internal marketing strategies, right? You said local med, that book now button, right? Like schedule, at the same time, the chat feature on the website, and then the request, the form, right?
Yeah.
So those are like on the website. What else are you doing to bring in these people?
That's how we've met. I embrace social media. Big time. Big time. So I really focus on Instagram. I've been training with Jessica Emitrr, who's now a retired dentist, but she teaches dentists all about brand and social media, and she lives on Instagram. That's how she sold her dental practice, and she wasn't even trying. So I've trained under her for like at least 5 years now.
Wow.
And so I do all my own postings, and I post to Instagram, and usually I use that content on Facebook also. And I use it for my practice. And I also post on my personal brand, because she's taught me to build a personal brand for whatever my next phase might be, if and when I retire. So I have a personal brand, and then I post to stories at least once a day, usually more than that. So I do that, on myself, and it's a little time consuming, but I've learned to do it very quickly. I have a lot of content. I've been to all Jessica's content creation workshops, so I've got tons and tons of content, and I belong to her Dental Soiree content club. So I have 30 hashtags and captions and photos every month, and I can use my photos with her captions or her photos with my I can mix and match. So I do a lot with social media and a lot with building my brand. And people always stop me. They may not be patients. I see you on Instagram all the time. I see you. I love your Facebook. I love your Instagram. And you know what? If someone, they might not be a patient, they might not be looking for a dentist, but as soon as someone they meet or know needs a dentist, I'll be top of mind because of, my presence. So I, firmly believe in it, and it's a work in progress. It's a long race. I'm sure you know all that too. But I think it really works. And I wrote an article in Dental Economics about this also. I also use the Facebook groups. So there are groups in my area, my town and the town next to me, town next to that. And I join those groups. And anytime someone's looking for a dentist, if I'm mentioned, then I'll get a notification. But even if I'm not, a lot of times I can just go in and put the word dentist, and I can see who's asking for a dentist, but usually somebody recommends me. And whether they do or they don't, I go in and private message them. And I don't say, can I make an appointment for you? I'm more like, I want to tell them who I am, ask questions and what they're looking for. And then I'll link my website. And we've gotten a lot of patients from that, a lot. Because 99 out of 100 dentists have no idea what those Facebook groups are, and would never even know or think to send a private message to these people that are looking for dentists.
Yeah, that's true. Do you ever think, Joanne, you may delegate this or no?
I can delegate a lot of things, but at this point in my career, I want to do less clinical. I mean, I've been out of dental school 36 years. I actually enjoy this. I really do. And I mean, definitely you can. And Jessica Emitrr suggests that you let the teams live on social media. So let them do this. I like my voice. And I think, it's hard to kind of get your team members to feel your voice. And I want it to be my voice. And I enjoy doing it. I'm up early. And usually that's what I do very early, like 6 o'clock in the morning. I'm putting together content. I don't batch. I know some dentists will batch a month or whatever. I don't batch. I do it on the fly, and it's easy for me because I know how to do it, and I enjoy it, and start doing some reels and all that kind of stuff. In fact, my daughter, who's 31, who is, very creative, very savvy, she says, where do you get all your content from? And I showed her some tricks and different things that I do and everything. But
nice.
So I actually enjoy it. I do.
Yeah. Yeah.
The other thing is I respond to other people. You have to do that. You have to respond to other people, their photos and their caption and just the different things that you see. You have to respond to them also. You can't just expect people to comment and respond to you or like things you're posting. You have to really, work it.
Yeah. What do you feel like since the moment, I guess, throughout this time, what do you feel like has not really worked well?
Print ads.
Okay.
Print ads. I mean, years ago I did print ads. And usually I would get one decent, case from it. But what happens is they have like Baltimore's Best Dentist. Well, every dentist is in that issue. So then I thought, well, maybe I should be in the issues that aren't the Baltimore's Best Dentist when there aren't as many dentists. So that's, kind of a trick. But Print ads, have not worked great. I never did mailers, but I have a feeling mailers probably wouldn't be great, but I never did that. I'm trying to think. Well, like I said, the social media is a long game. So there are probably a lot of people out there who are just posting once a week or once every 2 weeks or twice a week. So that's not going to work. And so I post at least once a day.
Oh, so like once a day minimum is what's going to be like working.
For your post. It goes, for your post, but then you have to have at least one story a day, if not more.
Gosh.
Stories are on the fly. What's happening during the day? Are you highlighting a team member? Are you delivering a cosmetic case? Are you celebrating someone's birthday? We celebrated 2 people's birthdays in my team today. So I have that content from the birthday cake and the gifts. And we did one of them, we did a boomerang. And so if you follow Crossroads Dental Arts tomorrow morning or anytime tomorrow, you will see a story or a post. Sometimes I'll even use the same post as a story. You can certainly do that. It's different people live on different platforms there, or some live on stories, some live, just on your Instagram, some live on Reels. So I do a little of all of it, and sometimes I do the same content.
Nice. Okay. And then, so how are you getting also when it comes to internal marketing, like more referrals and reviews?
Well, we use Bird Eye for our reviews, but a trick and Bird Eye's been great, and I've used them for years, and I think Len Tao is great. And I met Len Tao at a dental meeting, and he knew of me. We had met before once, and he dragged me over and he said, let's look, you have 100 reviews. I said, yeah, but the guy across from me has 200. I'll never catch up. He said, I can get you to surpass him in no time. I'm like, really? And oh my God, did I? I mean, I got to the top and very quickly, and I don't even look now, but I'm sure I have more reviews than anybody in my area. But I also respond to my reviews. So when I get the notification that somebody gave us a review, I will respond to it. Bird Eye comes up with an automatic response, and sometimes I'll use that, but sometimes I'll change it, or I'll put little emojis or something like that. But yeah, I have to. That's really powerful when you can respond to your reviews. People,
and it's always different responses, right? Like it's not just the same generic one. Like, oh, thank you.
No, because I kind of feed on what they say. If they say I loved the hygienist Patty, then I'm going to say, so glad you like Patty. You'll see her again next time. Whatever, So it's definitely not generic. No, we definitely.
That's how you're getting like a little bit more reviews, and at the same time, referrals come from that, or people see that. SEO even sees that, right? Like Google sees that, and kind of gets it. What about referrals? Do you just ask people, like your existing patient, like, hey, if you have a friend?
So this is what we do. We sit the patient up. We finish the procedure. We sit the patient up. I have my business cards in the operatory with my phone, my cell number handwritten on the back. And again, I'm an empty nester. So a lot of the things that I'm talking about or saying, people might be like cringing and like, I'm done listening to this woman. But you have to know that I'm an empty nester. So I have more time to do these things. So we handwrite my cell number on the back, and we sit the patient up, and I take the card and I say, Mrs. Jones, we're finished your procedure today. I give her all the post-op instructions. Here's my business card. It's got my cell number written on the back. If you have any emergency, or if you know anybody who needs a dentist, we'd be honored to see them. And with 2 hands, I hand her the card. And so that's how we ask for referrals.
Nice. Typically, if you can track that, how many would you say you get in like a month or so from that?
That I don't know. I just know we just track through Dentrix where the referral source is coming from. So if it's another patient, we put the patient's name. Through my marketing company, they have us, there's like I don't even know what you call it, a whisper, whatever. When the phone rings, it'll say Google advertising or different words. So, and we have to write that down. Whoever answers the phone makes that new page. So we put that into Dentrix, and our marketing company sees all those results. Used to be years ago, we got way more patients from other patients referring. Now, because of the marketing I'm doing with SEO and Google AdWords and all that, and pay-per-click, because we do a lot of different things, we get a lot more from Google.
Gotcha.
Yeah, a lot.
Who's your marketing company?
Evan Lazarus, Simple Impact Media. He's been a game changer. Len Tao told me about him. We started using him the month before the COVID shut down, but he was so gracious and drastically reduced for those 2 months what I was paying him. And then he said, let's turn off the pay-per-click, or, because we were closed, other than for emergencies. So he's been great. And I've referred lots and lots of people to him. I spend a lot of money with him, but I have a budget. It should be like 3 to 5%, they usually say, but for a mature practice like mine, it should be closer to 3% for marketing. But not all my dollars go to him. Bird Eye is marketing, and different, there are other things that we do, the toothbrushes with your name on it, that's marketing. The chapsticks with your name on it, that's more, all those kinds of things go under marketing budget. But
gotcha.
I always make sure that everything's in line.
Yeah, definitely. That's also okay. So then now you're doing a lot more speaking, right? So
I did a lot of speaking prior to COVID, and then a lot of these kinds of things and webinars during COVID. And then now, like I said, I was getting these associates on board, and I really haven't focused on or thought about it. And then I was just asked to speak at local dental society in a couple of weeks. And then you reached out to me, and then somebody else reached out to me. So it's been kind of crazy.
Do you see that doing more in the future? Like and then what are you going to be speaking about? Like, what do you feel like is your hit?
Practice management and marketing. Any of those kinds of topics. Yeah.
And you want to, do you feel like you're going to be doing more?
I have several PowerPoints that
Nice. Is it something you want to do more of in the future or no?
Could be. Yeah, I have a lot of ideas. One of my favorite PowerPoints is outside the box dental marketing. In fact, I talk about ground marketing in that. Yeah. So we talk about internal marketing, external, something that I call internal, external, or external, internal, where you do something internal marketing becomes external, or external becomes internal. And then we talk about ground marketing, and we talk about digital marketing and reputation marketing.
No, reputation marketing.
Social media marketing.
Gotcha.
That's all part of digital. Yes.
Okay. So that's interesting. And then this upcoming one in this week, what is it going to be about?
The touch points in dentistry. So a couple things that we just talked about, whether it be how we touch our patients, obviously not physically, through our website. There's 3 ways they can get in touch with us. Then what else did we talk about? The business cards, how I hand the business cards. We talked about the social media and how you respond to patients that way, or you respond to Google reviews. Then another thing we do is every new patient, and we got this from my marketing company, they gave us a slip of paper. Every new patient, a little form is filled out with their name, the date of the appointment, what they're coming in for, or maybe who referred them. And that is handed to the doctor that's going to be seeing them. And that doctor, the same day that they make an appointment, calls that patient. And is this really the second point of contact, because whoever answered the phone was the first point. But just sort of introducing themselves, make sure they know how to get to the office, that they've done paperwork, or that they've received the paperwork, and just see if they have any questions ahead of time. And I feel like that really helps with patients not showing and keeping their appointments, because I don't know about other dentists. I'm assuming it's similar, but I feel like it's so easy now for patients to say, I was exposed to COVID, or I don't feel good, or I might have COVID. And just the cancellations and no-shows really have, I think, are more than ever. So with this new patient slip, I feel like that really ensures, the patients are going to keep their appointment. So that's a nice little tip for anyone you can do out there. That's pretty easy.
Yeah. Shows interest, right? It shows like appreciation at the same time. Like, hey, man, this is for you kind of thing.
Like, I'm going to be your dentist. This is who I am. Can't wait to meet you. That kind of thing.
Yeah. No, I really like that. I like that a lot. So then I know we were talking about your team, right? Bringing more people, or bringing 15 right now. Would you say this is the solid team? happy with everyone. I know you also do team appreciations, right? You said tonight you did a team
Yeah.
appreciation dinner. Do you do
And we
more?
already talked about the Christmas event. We do a nice, really big, unusual Christmas events every year.
So do you feel like doing a lot of these things? Because I know you say like, no, do you pay them a little like normal salary, but like obviously they get raises and things like that. Do
And
you
bonus,
feel
we're on a bonus system.
and bonuses? Do you feel like you have to do these type of things like dinner appreciate, like, you know, these in order for them to feel, how do you keep them
Absolutely.
happy?
I mean, they all had such a nice time tonight. Unfortunately, a few couldn't come for various reasons. I think we had 11 out of 15. One didn't want to drive in the dark. One has a job after hours, you know, all those kinds of things. But no, it was really great because everyone kind of lets their hair down, so to speak. It was a whole different feeling than when you're at the office. It was great, you know. So we had a really nice dinner tonight. But I really like to do fun things that, you know, at the holiday time. Last year, it was great. There's a really upscale restaurant right by my office. And I pre-planned appetizers. We were set at 2 tables because there was so many of us. And then they didn't know. And we had all kinds of fun favors on the tables. They're still talking about the favors. And then we went over to other tables and we had a woman there called Boards in a Box, because these charcuterie boards are such a big deal now. And she had all the foods and a lesson and the history all about charcuterie boards. And everybody left with a gorgeous, huge charcuterie board. And then we went back to our tables and we had flatbreads, like real fancy flatbreads and salads. And then we had dessert to go because I knew everybody had to get home. And we also did one of those white elephant swaps. But I didn't want my team to have to spend the money for the, you know what a white elephant swap is? Yeah.
Yeah.
Well, let me just spell it real quick for those who don't know. You have one gift for everybody in the office. And what I did was I bought all the gifts. So I bought a variety of gifts and they're all wrapped differently and pretty. And they're all on a table. And I think we went with the oldest employee, not the oldest age, how long they've been with the practice. They went up and they pick a gift and they open it and everyone oohs and ahs. And then the next person, they can steal that gift or they can open a second gift. But if you've opened the second gift, you can't go and steal the first one. That's your gift. But then someone else can steal yours. And then when they steal yours, then you get to open another one. So everyone will have a gift. But anyway, that's how it is. So we did that and it was a great night and they're all still talking about it. But
what was the hottest gift there? What was the one where everybody's like, I want that one, or no?
There was like a really nice tote bag and a bright orange a big tote bag, you know, like really nice. They all love that.
That's good. That's good. And what were you going to say? You said, unfortunately, what?
You know, unfortunately, we've had some turnover even since, you know, last Christmas, we've had turnover. And like I hired one dental assistant. I really liked the woman and I knew she lived too far. And sure enough, she found a job closer to home and, you know, that kind of thing. We had a hygienist who wanted different hours, never told me. And I mean, replacing a hygienist, you can only imagine. Took about 3 or 4 months. Luckily, I'm a hygienist, so I'm not going to like put these patients off. I will pick up a scaler. I don't mind. I want my associates doing the dentistry. I will do a cleaning or 2 or whatever I have to do. When we came back after COVID, I refused to let all these patients have backlogs. So I did a lot of prophies, root planing, perio maintenance. I did a lot. And I know a lot of dentists won't do that, but like I said, I'm very hands-on. I don't mind doing it. I'm a hygienist by profession, so it's not a big deal.
Yeah, that's real humble. That's nice. I appreciate
Thank you.
it.
But the other thing is you're going to find dentistry to do. And I feel like if you're sitting with the patient for an hour or 45 minutes or whatever it is, you know, and look, usually I would give myself, let's say 45 minutes because the assistant can be starting another room, you know, so it's really an hour appointment. But if I find a filling to do or a crown, you know, can use 2 or 3 rooms and I can get it done, you know, while they're seeing the next patient or taking a medical history or taking a full set of x-rays. So I've always found that it's been cost effective for me to do that. You know, I can definitely do that.
Yeah.
I'm not going to do all my own hygiene. Like I know some dentists have had to do, or choose to do. My practice is big enough that I can, we have 2 full-time hygienists.
Vegan
That's
outsource.
nice.
Yeah. No, I get you. I get you.
I mean,
Throughout
I
this,
can see us needing another part-time one at some point.
yeah. So that'll be 16 team members. Wow. Okay. Throughout this time, though, from the moment you decided to bring on associateships to right now, what have you learned? What advice can you give us who we're in that process where we're like, we're going to bring on some associates, or we've tried, but it's just not working?
Well, you have to know what how they've been trained. I have an associate now who graduated dental school, has never done a fixed bridge. Now, you're not a dentist, but in other words, they've done crowns, they've never done a fixed bridge. And I had a patient, I said, I want you to do this bridge. And she's like, well, I've never done a bridge. I'm like, well, it's no different than 2 crowns as long as you have a path of insertion. So, but I've had to help her with that. But I found that removable partials and dentures, they really need help, taking impressions and just things like that. So, and we don't take a lot of impressions because we're scanning most of the time, but like for bleaching trays, we'll take impressions, or sometimes if a patient is fully edentulous, we'll take impressions to make the dentures. I mean, now it's getting better with the technology with using scanners, but still, there's just a lot of things. They don't know anything about coding. So really helping them in learning, like they'll have a new patient and the patient will be classified as a class 2 or 3 perio, and they're charging out as an 0150, which is a comprehensive exam where it should be a comprehensive periodontal exam as long as they're doing 6 points of probing, which they need to be doing anyway, and checking the mobility and the recession. So just knowing how to code that properly, not to mention you get a few more dollars, for that code, but just all kinds of things like that.
Yeah.
If a patient, like today, patient canceled last minute, it didn't show, or I can't remember, but I said to my associate, go ask the front desk, go ask someone to call your next patient to bring them in earlier. That way, when you check a hygiene patient, if they need a filling done, you'll have time to do it. Things like that. They just, with scheduling and coding and certain procedures. But you have to really help them.
Kind of hold their hand.
A lot of times I'll say, make sure I'm in town because I'll be at a dental meeting, or I'll be wherever babysitting my grand. Make sure I'm here because I want to help you insert that partial or try in that framework or seat deck, whatever. You can't just assume that they know how to do all these things, because you don't. I mean, if you have to redo or anything like that, it just, you lose all your profit.
Where would the line be, Joanne? Like, if somebody were to tell you, like, I am doing that, would you tell them, like, keep doing it? Or would you tell them, like, oh, you've been doing it for 2 years, that you need to let them go? Like, you need to find somebody else.
You mean a procedure?
Yeah.
I'm not quite sure I followed that.
For example, like, let's just say, how you said, I want to be there with you. I want to guide you a little bit. Right. And then 2 years later, you're kind of still saying, like, I want to be there with you. I want to guide you. Right. And it's like, well, you hired that person for a specific reason, right? So you don't have to be there anymore. Where would the limit be?
That would be a problem, but that would be a problem. Most of my associates, a couple of them were there several years. That's another thing, you asked me about the associates. A lot of times it's not till after they leave and then you start seeing the patients that you find out that things maybe weren't done to the level that we would want them. And that, I'm not saying I'm the best dentist.
Yeah, no.
But still, when you see either an open margin or recurrent decay or, short fills and whatever it is, that's a problem.
Yeah, yeah.
But no, I would think that if you're starting to see where they're not catching on to certain things, either they're not doing those procedures anymore, or it might be time to
kind of like, okay, yeah, like let them go, kind of thing, right?
Well, the other thing is, if we've had where sometimes the patients don't care for the dentists that we've had or whatever, that's another problem.
What do you do in that scenario? Do you just are you happy, or you take them on? I mean, like, as you, or do you just kind of push it on still to the patient, or what do you do?
I have taken some patients that were unhappy and moved them to myself. And the hard part is getting patients who say, why don't I have Dr. Rief? I thought I was going to see Dr. Rief. And I'll have to go in there and smooth things over. And most of the time, I mean, almost every time, they want to stay with that dentist. Once they've experienced that dentist, they're like, no, I want to stay with it. I'm like, great, stay with her. I'm glad you love her. She's prettier and younger than me or whatever,
No,
So.
yeah. But then that's mainly the objection, right? You want them to all go to the associate. Throughout this time, one of the last questions I want to ask you is from the moment, I guess because you've been doing this for 49 years, almost 50 years.
36 as a dentist, but yes.
But in the, you know what I mean, in the industry, but 30, that's still a lot, right? Like you know a lot, a ton. You're like basically just a plethora of knowledge. So throughout this time, I guess from the moment you decided to jump in to now, what's been some of the biggest roadblocks or struggles or failures you've encountered?
Well, I always say that, what are my regrets in dentistry? Well, my first regret is that I didn't do a residency after dental school. I mean, I know now a lot of the students, they want to get going on their paying back their loans, so they're not doing them. When I got out of school, pretty much 99% of the class did a GPR or they went to specialty. I went to work with my father. The residency that I got or whatever, I just wasn't going to be for me. And I probably didn't apply to some of the ones that I should have, but whatever. I just decided I was going to go into practice with my father. So that was sort of my residency. My father said his residency was he went into the Air Force. He was the only dentist on the base, and that was like his residency. In fact, he was stationed in Southern Texas, so that's where I was born. But that was one regret, that I didn't do a residency. I feel like that would have really been great for me. I feel like dentistry or dental school 4 years now with implants and all the different things that dentists can do or do now that they didn't do or learn when I was in dental school. I really feel like dental school could be 5 years. So I didn't do a residency. And the other thing is not owning a practice sooner. That, waiting 18 years, but you know what? It worked for me. I raised my kids. I could be there for their tennis matches or the basketball games, especially working with my father. I could kind of make my own schedule, but I always worked full time. And my parents, as they got older, took a lot of vacations. And when my father took vacations, I'd work 6 days a week. I would cover his day. He always off on Wednesdays. Back in the day, dentists always took off on Wednesdays if they played golf. Now it's Fridays. But back in the day, it was Wednesdays. So that was always my busiest day because all the dentists in Annapolis took off on Wednesdays. So I got all the emergencies all over town. And he worked like a half a day Saturday. So if he went away, I would work pretty much Monday through Saturday. And they would always go away for like 2 weeks at a shot. So, I worked hard. And, dad did pay me well, but I was able to raise my kids. It wasn't until they were like, I think around middle school-ish that when I bought the practice. And the practice I bought, where I still am, is like 7 minutes from my house and 7 minutes from where they went to school. I mean, obviously they're not in school anymore. So it was ideal. It was a dentist I knew, and he had gone to LVI and he had 2 practices, and he wanted to sell the one that I bought and focus on a boutique practice at his other location. So that's what he did. And then he sold that one later on and went to work at the dental school in the GPR program. And unfortunately, he passed away during COVID. Not of COVID, but he did pass away. And he was fairly young. And I really considered him a mentor, like I do my father. And it was a shame. It was, still can't believe it.
Oh yeah, man, I'm sorry about
After
that.
I bought the practice, he really mentored me. He got me to go to LVI to learn the cosmetics and all that, and the neuromuscular dentistry. And he was always there to help me. Always.
Yeah. So I know you mentioned, and this is another one of the last things I want to ask you. I know you mentioned about the partnership, how it didn't work out. Why?
It wasn't a partnership. I bought the practice from him. He had a largish office. So he had a woman there who I had to share space with. She had first dibs. She didn't want to take over the whole office. I bought the patients from him and we split the facility. And we had she was an HMO type of practice, and I didn't know that. And we had very different philosophies. I wanted to spend money fixing everything up, and she didn't. And we had a 6-year lease. Can you imagine? I said, it worked great the first day. And after that, it didn't work so well. So, but I had 6 years left. So after 5 years, you know, I had a dental CPA at the time, and he said, you got to start looking. So I offered to buy her out, but what she wanted for me to buy her out, I could build my dream practice across the street, which is what I did. And I built 5 operatories. And then 2-ish years later, I was able to expand, and I now have 8 operatories.
She's still in front?
Excuse me?
Is she still in front?
It was across the street.
Oh yeah, she's still across the street from you?
Well, she just recently, I think she tried to sell the practice. She didn't even have a website from what I've been told. And so, yeah, I was like, so she, I think, moved into another dental office, which I guess she's going to transition the patients. That's what I'm guessing. But after 5 years, you know, I found this other space. I'm next door to the top oral surgeons in the area. And that's where I wanted to be, because I knew I wasn't going to place implants. And I wasn't going to take out their molars and whatever else. So we have a nice relationship. They have several offices, but I'm literally next door. And when I wanted to expand, they wanted me to take more space than I thought I needed. So the surgeons took over a little bit of my non-clinical space. And then I was able to expand the other way. So it was a win-win for everybody. So
nice. Awesome.
Yeah.
Joanne, thank you so much for being on with us. It's a pleasure. But before we say goodbye, can you tell our listeners where they can find you?
Sure. My email is probably the best, and it's dr.jbr@crossroads with an S dentalarts.com. So it's dr.jbr@crossroadsdentalarts.com.
Nice. So guys, that's going to be in the show notes below, along with their social
Thank
media.
you so much for reaching out. I know it's been a while. It's been a really long while.
Yeah,
but I see you, I see you on social media all the time.
Yeah. We talk on social media and stuff like that. Yeah. But it's nice. It's nice to, like, you know what I mean? To talk and everything like that, kind of like conversate, catch up and things like that, because you've been growing. You've been growing a lot.
Yes.
And so it's exciting. It's exciting. And you see in the comments and stuff like that, people want to know what you're doing. So it's good to have you on. But awesome, Joanne. Thank you so much for being with us. It was a pleasure.
Thank you. Good seeing you and talking to you. And it's been great.
All right. We'll hear from you soon.
Thanks.